Invest Africa, proudly brought to you by KPMG.
Hello and welcome to Invest Africa. I am Nozi Pombandra. Today we are focusing our conversation on communicable diseases in Africa and really trying to get to the nuts and bolts of whether the continent is moving in the right direction in terms of curbing these. Joining me to unpack this conversation, I'm joined by Dr. Marlin Mckay. He joins me here in Johannesburg and he's from Meta Hospital. He's a health practitioner in Johannesburg. And joining us from Nigeria, we're joined by Dr. Francis Ohanyido. He's a senior advisor and national pneumonia coordinator at USAID in Nigeria. In the second half of our program, we're also going to be joined by Dr. Victor Ngani, and he's a health practitioner from Meta Hospital in Nairobi. Now, for those of you at home, if you want to be a part of these conversations, you can certainly do that. That's just by dropping us a tweet. The hashtag is Invest Africa, following us at CNBC Africa and myself at The Real Nosy. Let me start off with you, Marlin, just to give us a sense of communicable diseases in Africa and what the state is. Are we winning that battle or not?
I think just on a broad level, the continent of Africa is fairly unhealthy at this point in time. I think we are making some strides. However, if you look at the main indicators of health in any part of the world and comparing them to what's happening in Africa, we can see that we are lagging behind. And some of your main indicators would relate to life expectancy. I think the average in the world is in the 60s going to 70s, and in Africa, 54. If you look at the infant mortality rate, that's kids dying under the age of 5, we are still very high compared to the rest of the world. If you look at the maternal mortality rate, we are also lagging way behind. And even the amount of doctors that we have per section of the population, say 100,000, I think we are less than 5, 2.3 per 100,000. So just in terms of those indicators, broad indicators, it gives us a fairly good idea that we are not doing that well. And if we are going to make strides, we have to focus on those areas. And then if you look in terms of more specifically what are people dying of on the African continent, that will even give us even more clues of where we need to focus our energies. And the main scourge still remains HIV AIDS related to TB, respiratory illnesses and diarrheal illnesses. And those groups encompass most of the communicable diseases that are inflicting all the pain that we're having in South Africa at the moment, or in Africa. Dr.
Francis, the key theme that Dr. Mckay is putting on the table is that Africa is lagging behind. Perhaps just give us a sense of the implications of this slow progress on Africa's economies on a broader scale.
Yeah, I agree with the things he put on the table in terms of the challenges around communicable diseases in Africa and how they impact the economy in a sense comes in significantly. But I also like to add that some of the two areas, locus of diseases that we are now seeing in Africa that are beginning to challenge our economies are the emerging and re-emerging diseases, for example, dengue and Ebola fever Ebola and dengue. They are really coming up strongly in Africa recently, and you can see the damages done recently in West Africa by Ebola fever. To the extent now it's becoming almost endemic in West Africa. But the challenges are also that there is also a group of diseases that we often forget, which is the neglected tropical diseases. Is a group on its own, and it's a very large group, and this significantly affects the quality of output within the economies of West Africa or African countries, because a large chunk of disease is both found in Asia and Africa. So these things impact on the economy. For example, annually we look at Africa in terms of, let's say, life loss, for example. For malaria alone, at least close to 600,000 people die annually from malaria alone. So, and this cuts across all strata of the population, which means in terms of even quality of output in the office space due to malaria infections alone is significant in terms of how we look at our economy. We also look at the issues of what Ebola did in the health systems in Africa, for example, in some of those countries. You cannot really quantify them in anything less than billions of dollars in terms of the impact on the economy of West Africa alone. So these are issues. Then there's also the the drug-resistant TB now that is coming up and challenging health systems. In countries where they occur, they spend more money per person, per bed space in those countries for treatment of such cases. So these are areas that we have not even gone to harvest the figure in terms of the numbers, in terms of money. But these are significant in Africa.
Marlin, but what about the fact that we're waking up to news that there have been new Ebola cases in markets like Liberia? Because on the one hand, we're hearing that we're lagging behind, but could we possibly be regressing in some markets, and why?
I think you will have occasionally some repeat cases or new cases coming to the fore. And just because there may be a minor outbreak in one particular area may not necessarily mean generally that we are regressing. I think we need to focus directly on those particular cases and see where we are going wrong. And historically, if you look back at what happened with the Ebola epidemic, there was a number of issues. You know, traditional cultural practices in dealing with the dead, mistrust of the healthcare system, mistrust of government. You know, all the conflict and the lack of resolution of conflict in those particular areas. So if you home in on specific areas, I don't think it's necessarily a general issue, but I think we need to refocus our energies as to see what is it medical, is it socioeconomic, is it political, and then focus on those things and see what we can do about it.
So Dr. Francis, on the one hand, Dr. Marlin tells us we need to focus on the source and what the root cause of the problems are, but what about the response? Have we learned enough lessons from the recent Ebola outbreak to have stronger and more coordinated responses to breaks out such as Ebola and others?
Okay, just a little correction. I'm now the National NTD Advisor for Nigeria for the Sabin Vaccine Institute. That's neglected tropical diseases, which makes it even more decent. I left USAID some time ago. Yes, it's very important. There are a lot of lessons across board that have been learnt from the Ebola thing and the Ebola problem. And the crux of it is that the health system comes first. We must be able to make sure that the health system works, irrespective of which country it is. They have to find a way that it works for them so that they can have better response, better ability to mobilize resources, not only money, but also in terms of mid and lower level frontline health workers to be able to tackle such problems, because this is where the challenge is. Community level involvement in the healthcare system, we cannot do without it. And one of the things that came out of the Ebola epidemic was the fact that the health systems were not responding at the front lines. Right. If they had responded effectively at the front lines, the health system would have been better able to curb this. Maybe Nigeria did better in terms of response because somehow we had a system that was already in place. We had a national Centers for Disease Control in Nigeria, which was able to begin to galvanize with the primary healthcare architecture of Nigeria towards responding for Ebola. But most of those other countries, especially coming out of war and strife and all that, didn't have such capacity to respond. This was a critical lesson. And the ability, like I said, to mobilize critical resources, not just physical resources, but also manpower, is also a key part of response for disease. And it can impact on the economy in that it can dislocate even resources in the economy.
So two very important issues that I think we need to touch on, and the one is capacity and the other one is community involvement. Perhaps, Dr. Marlin, bring in the progress we've made in terms of taking the stigma away around some of these diseases to really get communities to step up and lead in terms of making sure that treatment is had. Yeah.
So stigma plays a role in terms of identification of cases, and you can take it across even to HIV. But I think in Ebola, the main issue, and we saw that in South Africa, just the fear and the paranoia around it. And when we actually got into the nitty-gritty and started explaining to communities out there the issue of direct contact with bodily fluids in terms of transmission, a lot of the stigma was then taken away. So if you look specifically at Ebola, education, community involvement played a vital role in identifying of cases, and then also in management and preventing further infections by reducing the personal contact with bodily fluids. If you take the issue with HIV, I think we're still lagging behind in terms of stigma, that especially in Africa, late presentation is the end result of stigma, where patients are stigmatized the fear of coming forward, the fear of being identified, and the fear of any victimization as a result of that.
What would you suggest one should focus on if we're trying to get more effective preventative campaigns? Is there a new way that we should be engaging with communities if we're going to reduce the number of new infections?
I think if you take HIV as a specific case model, case example, I think the positive messages that are coming out is that it is now a chronic manageable disease.
Right.
And for me, that's the biggest news in HIV. So no longer is it a death sentence. So no longer does one have to have the fear of coming forward and then being left alone and dying with your community. There is so much that one can do. The other positive message that comes through is that once you have been identified and put onto a treatment program, you are no longer infectious.
Right.
So now the protection spills over not only to you as an individual patient, but to the community, because now the community viral load will be suppressed. Further new infections can be reduced, and so the community, the population, and the whole country benefits just by each one coming forward, knowing one's status, getting onto treatment. Right. Taking the treatment properly and making sure that your viral load is suppressed and hence no further new infections. And that's how we're going to win the battle across the spectrum. So
we're certainly getting some know-how into what the foot soldiers on the ground fighting to ensure that communicable diseases in Africa are curbed, what needs to be done. Let's take a short break. When we come back, we're going to focus on the money trail. Is there enough funding behind ensuring that this part of our health issues on the continent is being taken care of? Now, remember that in the second half of the show, we are bringing you a voice from Nairobi. And so we say thank you now to Dr. Francis Ohanyido. He's a senior advisor and national Unoma coordinator, and he's with TSHIP in Abuja. Dr. Marlin Mckay stays with us, and he is a health practitioner here in Johannesburg. Let's take a short break. We'll see you in Welcome back to Invest Africa. Still with me, my guest, Dr. Marlin Mckay, health practitioner here in Johannesburg. And now we're also joined by Dr. Ouma Oluga. He is the secretary to the Doctors Union based in Nairobi. Gentlemen, welcome. Dr. Marlin, let's come back to the money trail. Are we getting a sense that communicable diseases have not fallen off the radar when it comes to fiscal priorities in South Africa and maybe even the broader continent?
I think all countries, and especially in Africa, we acknowledge that if we are not investing money and spending money on communicable diseases, we are not going to win any battle whatsoever. We are lagging behind, and the priority has to be fiscal injection into making sure. Okay? And so where does the money come from? I think firstly, countries need to spend more money themselves on the healthcare budget.
Right.
I think if you look at some of the success stories, like in Ghana, for instance, where they have where delivery care services are free, so more women came forward for antenatal care, and the maternal mortality rate reduced substantially. Okay, so it can work two ways. I think we need to start moving away. Money from donors is going to be reducing. Right. We're not going to get sufficient money there. And so we need to look at our own healthcare budget system, investing more money, but also looking on the ground at community level in terms of assisting patients and maybe reducing fee for services, direct cash payments, and allowing more people to come forward to access the services free of charge. And for me, it will make a big difference in terms of reducing those numbers.
Dr. Ouma, I know we've just brought you into the conversation, but perhaps you can just give us a sense of how the Kenyan government has approached the healthcare budget and funding, in particular for communicable diseases. Are we finding that this is a priority in East Africa and in particular for Kenya?
I think the situation is almost the same as what the gentleman, my colleague doctor in Johannesburg, has talked about. The Kenyan government, unfortunately, is yet to prioritize healthcare as a whole, not just for communicable diseases. I believe this is a problem for the whole of Africa. Looking at the Abuja Declaration, actually in 2001, only 11 countries have actually moved towards getting to 15% funding for healthcare. And Kenya, unfortunately, is one of those countries that have been declining. This year, the Kenyan government allocated 2.8% of their national budget. Out of a budget of 2.1 trillion, the Kenyan government allocated only 59.2 billion, which translates to about 2.8% of the national budget. And that puts us in a problem, because even though we have not yet sorted out the problem of communicable diseases, we still have malaria as the leading cause of death in the country. We have issues of HIV. About 1.6 million Kenyans are still infected, with about 100,000 new infections every single year. So we have not yet optimized control and even treatment for communicable diseases. We have diarrheal diseases. Recently we had cholera outbreaks. And then now we are still even having non-communicable diseases also rising, but we have not yet controlled our communicable diseases. We're still having malaria. We are yet to get to zero with HIV infections. We have not yet, there's been a lot of progress in child maternal transmission, but still we are not yet there. So we are still in a bad fix. I think in the whole of Africa, East Africa isn't doing very well in healthcare funding. And I do want to agree that as much as we are talking, where will the money come from? I think we have the money. Our governments have the money. It's just that they have not yet prioritized the healthcare funding. If you are giving 2.8% of the national healthcare budget to healthcare, then there is absolutely no way we are going to get to control communicable disease. There's absolutely no way we are going to eradicate cholera outbreaks and malaria infections. So the money is there, and of course there are also a lot of donors coming into Africa. Kenya alone has about 26 billion Kenya shillings coming from donors. But again, that money I think may need to be prioritized. Unfortunately, policy in East Africa, or basically the whole of Africa, I think donors have a lot of say. So instead of governments telling donors where exactly the need is needed,
right,
where the money is needed, yes, they drive a lot of policy of what they want to do rather than what is important for the people. So I believe that is also an area of conversation where we could look at these 26 billion Kenya shillings. 26 billion Kenya shillings would translate roughly to about 25 million US dollars. So we have a lot of money that we can actually use to control some of these diseases, but we need the right policies, and government funding is still needed. The money is there. I believe that there's a lot of wastage in most governments, whether it's South Africa or Kenya or Uganda. So if we prioritized our healthcare and abide by the Abuja Declaration of 2001
right,
that advocated for 15% funding, then I believe we will be on the right track.
And I think what you've done, Dr. Ouma, is really opened up a very, very hot topic. And this, of course, donor demands trumping what the people need. But Dr. Marlin, let's come back to the urban-rural divide, because we also see a misalignment in terms of services when it comes to the medical and health space in this regard. How do we get that realignment back?
Yeah, I think we need to start focusing a lot more on the rural areas. But I think we've also done a lot, just in terms of building capacity, skills development, training, where even though we may not have qualified medical personnel in terms of doctors being accessible to everyone in rural areas, we've downskilled and upskilled nurses, for instance, who are primary care health practitioners, who are totally qualified in terms of management and even of the chronic diseases. And if you take the HIV model in South Africa alone, who have gone a far way in terms of assisting education, diagnosis, management of dispensing of ART medication. So that goes a long way. And if we are going to win this battle, we need to start focusing more on the rural areas. And that goes across the board. Vaccination, immunization,
right,
education, management of prevention of mother-to-child transmission. We are doing well, but a lot, as was mentioned, a lot can still be done in terms of focusing on those areas and reducing the numbers. The technology is there, the drugs are there, and we just need to make sure that, again, patients coming forward and resources are made available to everyone in rural areas.
So, Dr. Ouma, let me bring back this issue because I think Dr. Marlin also touches on it, and this is affordability and accessibility of healthcare, in particular for the bottom of the pyramid and the larger part of the population. If you were to advise government from a policy perspective, how do we ensure that we increase accessibility and we increase the affordability of healthcare, in particular around communicable diseases?
Health access is a big challenge in many of Africa, and I think again it falls into poor healthcare systems. We have seen even in West Africa, where there was the Ebola outbreak, it's simply a breakdown in the healthcare system. And I think the question of access and affordability cannot be isolated from a dysfunctional healthcare system. We have a situation where people do not have access, or they do not attain access, where you have the facilities are present at the rural facilities, but then sometimes the doctors or the nurses or the healthcare workers are not available. Or you have situations where people, the facilities for which are available, they can't afford it. This happens mostly in urban areas. For example, in Nairobi, where the nearest facility to you is a private facility, and therefore the ability to afford also comes in. So on one hand, I think the issue of access and affordability falls in universal health coverage. I think Africa must be very serious, and Kenya particularly must be very serious in terms of rallying the population, and the government must put up policies that actually will help people get access to insurance and also access to subsidies, sort of in a way to bring in universal health coverage. Here in Kenya, we have the National Health Insurance Fund that I think can be improved to cover more people. I think basically elsewhere, even in Africa, there must be some form of government insurance that I think can be improved to cover more people to have health insurance. On the other hand, also, I think the problem of also access also comes in with healthcare workers. Right. When you have doctors that are leaving Africa for other countries, Kenya included, then we must make sure that we retain those people. So we must handle our healthcare workers very well. We must make sure that we motivate and retain them. And then now, on the other hand, we drive a universal health coverage campaign. If countries like Japan actually achieved universal health coverage in 1961, I believe Africa should have 50 years to have learned, that we can actually do this. I think in Rwanda, they have some community health that is doing very well. I think such kind of initiatives should be multiplied.
Dr.
So
Ouma,
that we have...
thank you so much for those insights. We're unfortunately running out of time, and I just want to maybe give you an opportunity, Dr. Marlin, just to comment on some very important points that Dr. Ouma makes. The one is the feasibility of a national health insurance system in South Africa. Do you see that taking off? And also just the contentious issue of the private sector poaching healthcare workers from the public sector. Is that particular tension still prevalent in South Africa?
Obviously, the big issue in the context of South Africa with the NHI is funding. Where's the money going to come from? And for me, the other issue is let's first fix what's broken. Work on what our issues are now and try and fix that. I don't think the word poaching is necessarily correct in terms of private versus. I think many doctors in the public sector get disillusioned with the public sector and the lack of resources and become extremely frustrated and therefore almost driven out of that environment and into the private sectors. So we need to equalize the forces there so that there is no, whether it is financial motivation or just in a sense of satisfaction, job satisfaction, that would literally force my colleagues out of the public health sector. We should make things conducive to an environment where we would want to stay in there, whether it's financially and job satisfaction, remain there and fix what's broken so that at the end of the day, as you were saying, everybody in South Africa can have equal access to good health care.
Some fantastic insights from my guest today. Unfortunately, that's where we have to leave it for this show. A very big thank you to Dr. Ouma Oluga. He's the secretary at the Doctors Union in Nairobi. And of course, Dr. Marlin Mckay, health practitioner in Johannesburg. For you at home, if you want to be a part of these conversations, all you need to do is drop us a tweet. The hashtag is InvestAfrica, following us at CNBC Africa or myself at The Real Nosy. Let us know which sectors or hot topics in Africa you would like us to focus on. From myself and the Invest Africa team, it's goodbye.
Invest Africa, proudly brought to you by KPMG.